Every day, 140 people die from an opioid overdose in the United States. Communities all over the country are plagued by this epidemic, and yours could be too. The opioid epidemic was caused by the overprescription of overly addictive drugs by selfish companies. These drugs are rotting our country, but there are steps that can be taken to slow it. Today I'm going to be talking to you about the opioid epidemic and ways that it can be stopped in our country. A quote from Dr. Murphy of the Massachusetts Medical Society. More than 2 million people in the United States are addicted to prescription opioids, and more than 12 million report having misused these medications in 2015. They are a leading cause of death in America. This epidemic does not discriminate, no matter your race or gender or age. Opioid use is a leading cause of joblessness and homelessness in this country. Overdose deaths rose 30.6% in just 12 months after COVID started. Prescription opioid overdoses have grown 20% since 2020. A lot of that is due to a new drug called fentanyl. It is a street drug that only takes a small amount to kill, and it is being mixed in with other pills and street drugs. It can kill people the first time they use it. The USA has had more than 500,000 opioid-related deaths since 2000, which is more than any other country, via the Congressional Office. The opioid crisis has changed over time. The drugs have evolved, and as I mentioned before, fentanyl has entered the streets. Dr. Lewis Nelson wrote in an article in the Annals of Emergency Medicine, non-pharmaceutical fentanyl is often sold to users who believe they are receiving heroin, oxycodone, or other drugs of abuse, including stimulant drugs, such as methamphetamine and cocaine. Around 10% of people who are prescribed opioids will end up abusing them. Opioid-related deaths are a top 10 cause of death in the United States. The spread of disease is also another danger that is caused by opioid use. Dr. John Ward said in the New England Medical Journal, although political and public health leaders have begun to confront this urgent problem, hidden beneath it lies another danger, the increasing spread of hepatitis C virus associated with injection opioid use. It is plaguing our nation. Now, who does it affect? It has affected participation in the workforce due to side effects of opioids keeping people at home. Federal spending has also increased because more money has been spent on prescribed opioids through Medicare and other government insurances. Adults 35 to 44 experience the most overdose deaths. Children of people with opioid use disorder, or OUD, are more likely to experience maltreatment and therefore more likely to experience childhood trauma just because someone in their family is abusing opioids. Mental illness also means a higher risk of using opioids, about 3 times higher, especially depression and anxiety. Opioids also increase symptoms of mental illness. Since fentanyl hit the street, minority overdoses have increased, but in the last few years, opioid overdoses have increased across all races across the whole country. The biggest areas where opioid use takes place is in cities. The biggest opioid use in America is found in Baltimore City. Now that I've talked about the problem, I would like to explain how this epidemic began. In the 1990s, doctors began to prescribe opioids, promising that they would not be addictive. They prescribed them to people with simple problems like back pain, who did not actually need them. Nobody realized how addictive these drugs were, and soon millions became addicted. Then Purdue Pharma came in and introduced OxyContin, the most addictive prescribed opioid that you can find. PharmaD lied about how addictive OxyContin really was. Big pharmaceutical companies like Pharma paid off politicians to keep their drugs on the market so they could keep making money. The opioids that Purdue created were created to combat cancer, but 86% of patients were using them for non-cancer pain. As opioids became more expensive, addicts turned to heroin for a cheap and easy fix. And as time has gone on, more dangerous drugs, like fentanyl, have been introduced onto the market. And as the problem grows, so does the money and influence. Big pharma companies can do what they want because the government will not check them. They went unchecked and let many people die and suffer. Now that I've discussed how the epidemic began, I would like to offer solutions to the problem. First off, we need to make it harder for people to get opioids prescribed. A group of doctors from the New England Medical Journal said, it is also necessary, however, to implement primary prevention policies that curb the inappropriate prescribing of opioid analgesics, the key upstream driver of the opioid epidemic. This would include not giving people with minor injuries opioids because they don't need them and it's not worth the risk having more people addicted to these dangerous drugs. Having a universal database that tracks people's prescriptions also stops people from getting multiple prescriptions and stop doctors from being able to illegally hand out these opioids to people. Hard opioids should only be given out if the situation deems it necessary. The next solution is to reduce the flow of illicit opioids. Non-prescription drugs like heroin and fentanyl cause the most overdoses. The government is encouraging sharing information between agencies to keep law enforcement updated on the epidemic and help in all the ways that they can. Communication between agencies is the key to get these illicit substances off the street and keep the citizens of America safe. Another way that we can stop this problem is by promoting treatment. Medicaid now funds rehabilitation treatment in this country, and policymakers need to pass laws that will help people pay for their treatment. More people working are needed for these treatment centers. Some people are put into prison instead of treatment centers when rehab is the real goal. I will now play a video about a treatment center in Lancaster, New York.
Opening for the Lancaster location is happening at this center on Fountain Avenue. The CEO says that they're able to help the person, not just the addiction. Crossroads can provide outpatient and medication-assisted treatment for people with substance use disorders and mental health care. Patients can be seen by appointment only at the location or through televisits. And those needing treatment can contact their 24/7 call center to schedule. Crossroads will accept Medicaid and most commercial insurance plans. Scheduling appointments for the York location work the exact same way as this one. In Lancaster, Kate Merriman, WGAL.
Another thing that is important is community values. A quote from the National Library of Medicine says, "Addiction thrives in populations that don't." If we can create communities that don't support opioid use and can keep each other thriving, then we can keep each other safe. Dropbox and take-back events where people can hand in their opioids with no penalties are another way to get these drugs out of communities. In conclusion, millions of people are addicted to opioids and tens of thousands of people are dying every year. Selfish pharmaceutical companies were originally responsible for this problem and it has now grown out of hand. Street drugs like fentanyl and heroin are exacerbating the problem, but there are plenty of solutions. Reducing the flow of illicit drugs in the street, promoting treatment and safe use, and adopting safe community values. To wrap up, although this is a big issue, it is solvable. Opioid overdose is a top 10 cause of death in America, but with your help, we can slow the problem. Now that I've told you ways that this can be decelerated, I hope you take action.